Hi, my name is Andy Lord. I'm the lobbyist for Georgians for a Healthy Future. We are here today at the state capitol to meet with Senator Charlie Bethel. Senator Bethel is the new chairman of the Senate Insurance and Labor Committee, and he's going to be sharing with us today bills that are coming through his committee and some other bills that he is working on himself.
The first is certainly a major Senate initiative. It has been an initiative that the Lieutenant Governor has been very supportive of, as well as the majority and minority caucus in the Senate, and that is the effort to increase autism treatment. We passed Senate Bill 1 already out of the Senate, came out of committee. It is now pending action over in the House. I expect that'll be somewhere down the road, because we're pre-crossover day, so both sides are working on the legislation that originated in their chamber. But we think that's very important. We know that 1 in 64 Georgia children is now expected to have a diagnosis on the autism spectrum. That leaves us with what really is a public health crisis at the state level, and at the individual level, it's a personal and family crisis that needs to be addressed. The best treatment in terms of efficacy and cost, for that matter, for small children is the applied behavioral model, what they call ABA treatments. Those are often not covered by health insurance policies. So our effort is to make sure that the most efficacious and efficient treatment for Georgia children is available to them. And what's, I think, especially important about that is that they have an extremely high success rate, and I think you measure success by restoration of capacity. A child who may lose all symptoms of autism, that's to say, if they went to a doctor, they would not even be able to identify that the child had, if they didn't know a previous diagnosis had taken place. Or if not that, be able to be restored to a very productive life. And that's obviously good for an individual, but it's also great for Georgia. For the last several years, I and others have worked on an initiative to try and improve our adult vaccination rates. And it's important when we talk about vaccine worlds, is you have the infant vaccine rates, and Georgia really does fairly well in that category, but we lag the nation. The CDC is here in Atlanta, and they tell us that our adult vaccination rates are not what they should be. And that obviously costs everyone. And so many states, in fact the majority of states, have a model that allows for nurse practitioners and pharmacists to administer vaccines under a physician protocol agreement. This is a scenario where a doctor enters into an agreement with, for example, a pharmacist that says, if a patient comes in and answers these specified questions appropriately, you can go ahead and give them the vaccine. You don't have to have a prescription to do that. That's a national trend. And so it's an issue that I've worked on in hopes of improving our adult vaccine rates, and I know people get excited with respect to specific issues from time to time, and the measles outbreak is certainly a cause for concern. But it's really the longer term, bigger issue that I think is most important, and that is that we work to improve it. And I'm optimistic that this year we'll see some action in that area and move the ball forward, and hopefully see reduced costs, because it's a lower cost for the consumer and increased vaccination rates combined.